Turning 70 is a milestone that many people look forward to with a mix of excitement and anxiety. It's often seen as a point where life slows down, a time for retirement, relaxation, and enjoying the fruits of a long career. But the reality of what it feels like to turn 70 can be vastly different from the image we have in our minds, and it's something that even doctors don't always tell you. When you reach 70, your body begins to change in ways that are not only unexpected but can also be quite jarring. It's not just about wrinkles and gray hair, but about things happening inside your body that you may not even be aware of until it's too late. This is the reality people face when they turn 70, and in this video, we will explore some of those hard truths that most people don't anticipate and that even the medical professionals sometimes overlook. One of the most common and dangerous health issues that arises in people over the age of 70 is the loss of bone density. As we age, the bones become weaker and more susceptible to fractures, even with minor falls or accidents. Osteoporosis, a condition where bones become porous and brittle, is prevalent in older adults, but it is often underdiagnosed. Doctors may address it during routine checkups, but the severity and risk of fractures, particularly in the spine or hips, are sometimes not discussed in detail. This lack of attention can lead to long-term mobility issues, chronic pain, and decreased quality of life. Vision and hearing tend to decline with age, but the full extent of these changes can be underestimated. People in their 70s often experience macular degeneration, cataracts, or glaucoma, leading to diminished sight. Similarly, hearing loss becomes more common due to damage in the inner ear structures or from a lifetime of environmental noise exposure. While these issues may be addressed during specific screenings, many individuals do not receive adequate guidance on coping mechanisms or treatments, leaving them to navigate significant life changes with limited support. For instance, hearing loss can affect communication, causing frustration and social withdrawal. Another hidden challenge of aging is the gradual weakening of the heart and blood vessels. Many seniors face the development of cardiovascular disease, including high blood pressure, arrhythmias, and coronary artery disease. But these conditions often develop slowly and without noticeable symptoms until it's too late. By the time most individuals experience noticeable symptoms, such as chest pain or fatigue, heart disease may already have taken a significant toll. While doctors may monitor blood pressure and cholesterol, they may not always explain the cumulative impact of these silent conditions, which can result in heart failure, stroke, or other cardiovascular events. Cognitive decline is another hidden challenge of aging that people often don't talk about until it becomes a major issue. Dementia and Alzheimer's disease affect a growing number of individuals over 70. While memory loss is sometimes seen as an inevitable part of aging, it's important to recognize that Alzheimer's and other forms of dementia are distinct conditions. These diseases are progressive and can alter not only memory but also personality, cognitive function, and daily living skills. Doctors may discuss the early signs of dementia, but they might not fully prepare patients for the emotional and physical toll these conditions can have on individuals and their families. As people enter their 70s, they often face significant challenges when it comes to getting quality sleep. Conditions like sleep apnea, insomnia, and restless leg syndrome are common but can go undiagnosed. Older adults often experience lighter, fragmented sleep and may wake up several times throughout the night, making it harder to feel rested. While doctors may acknowledge sleep problems, they might not fully explain the underlying causes or offer enough practical solutions. As a result, many seniors live with poor sleep quality, which can lead to increased stress, depression, and a diminished quality of life. Loneliness and depression are not always adequately addressed by healthcare providers, yet they are serious and hidden health issues for seniors. As people turn 70, they often experience significant life changes, including the loss of friends or spouses, children moving away, or limited social interaction due to mobility or health problems. This isolation can exacerbate feelings of depression, leading to a diminished sense of well-being. Doctors may provide medication or therapy for emotional health, but may not offer sufficient resources for social connection, which is essential for overall mental and physical health. How does aging affect mental health after 70, and why is it rarely discussed? As people approach and enter their 70s, mental health often becomes a topic that is avoided or underestimated in medical discussions. While physical health challenges are more openly addressed, the mental and emotional changes that occur with aging are sometimes overlooked. The truth is, aging can profoundly impact mental well-being, and these effects are rarely fully discussed, despite their significant influence on quality of life. One of the most pressing mental health issues that older adults face is depression, which affects a substantial number of individuals after the age of 70. Although depression is often thought of as a condition associated with younger people, it is equally prevalent among seniors. However, the symptoms may be misinterpreted as a natural part of aging. For instance, older adults may experience feelings of sadness, loneliness, and a lack of interest in activities that once brought them joy. These signs can sometimes be mistaken for simply feeling down due to aging, rather than recognizing them as signs of clinical depression. In addition to depression, anxiety disorders also become more common as people age. The fear of losing independence, health, and loved ones can trigger feelings of anxiety, leading to a constant state of worry or distress. Anxiety may also manifest as physical symptoms like insomnia or a racing heart, which can sometimes be attributed to other health conditions, leaving the underlying mental health issue untreated. Unfortunately, depression and anxiety in seniors are often underreported and misunderstood, as mental health is frequently stigmatized in older generations, and emotional struggles are seen as a normal part of aging. Cognitive decline, which includes memory loss and difficulty with decision-making, is another mental health concern that becomes more pronounced with aging. Many seniors experience some form of cognitive decline, such as mild cognitive impairment, MCI, which can eventually lead to more serious conditions like Alzheimer's disease or other forms of dementia. These conditions can affect a person's ability to think clearly, remember important details, and perform everyday tasks, often causing significant emotional distress. However, the emotional toll of cognitive decline is often not fully explored. Older adults who are dealing with memory loss may feel embarrassed or frustrated by their cognitive difficulties, leading to a sense of helplessness or a loss of confidence. In some cases, these emotional struggles are compounded by a sense of identity loss, as individuals no longer feel like themselves due to the changes in their cognitive abilities. The fear of developing Alzheimer's or dementia is also prevalent, with many people avoiding discussion about it altogether, both with healthcare providers and loved ones, due to the stigma associated with these conditions. A significant factor in mental health decline after 70 is the impact of social isolation and loneliness. As people age, they often experience changes in their social circles, such as the death of friends or family members, children moving away, or the inability to participate in social activities due to physical limitations. This isolation can contribute to feelings of loneliness, which in turn can trigger depression and anxiety. Loneliness in older adults is a silent epidemic, and it's one that often goes unnoticed. Many older individuals may not express their feelings of isolation either because they don't want to burden others or because they don't recognize the emotional impact it's having on them. As a result, these feelings of loneliness are not often discussed with healthcare providers, leading to a lack of intervention. Social isolation can also affect physical health, as those who are lonely are more likely to suffer from conditions like hypertension, heart disease, and weakened immune systems. As people reach their 70s, they often find themselves reflecting on the passage of time and reassessing their sense of identity. For many, retirement can bring a loss of purpose, especially if their career was a central part of their self-worth. The transition from an active work life to a more sedentary or less structured daily routine can lead to feelings of emptiness or lack of direction. This loss of purpose can be exacerbated by physical health issues, which may limit one's ability to engage in activities they once enjoyed. Additionally, many older adults face the existential challenge of grappling with the idea of their own mortality. These feelings of uncertainty or existential anxiety are rarely discussed openly because they are often considered taboo or too difficult to address, both for the elderly and for those who care for them. One of the reasons mental health is rarely discussed in older adults is the stigma surrounding mental illness, particularly in older generations. For many seniors, the idea of seeking help for emotional or psychological struggles may feel like a sign of weakness or a loss of dignity. This stigma is often internalized, leading older adults to avoid seeking professional help or discussing their emotional challenges. Additionally, there may be a lack of accessible mental health resources for seniors, making it more difficult for them to receive the care they need. Furthermore, healthcare professionals may be more focused on treating physical health issues in older patients, and mental health concerns may be seen as secondary or even overlooked. Many doctors may not address mental health unless a specific diagnosis is present, leaving seniors without the support they need for emotional well-being. The lack of education and training in mental health for both healthcare providers and families can result in inadequate care for seniors' mental health needs. Why do many seniors struggle with sleep disorders after 70, and how can they manage them? Sleep disorders are a common challenge among older adults, particularly those over the age of 70. As people age, their sleep patterns tend to change, and many experience difficulties falling asleep, staying asleep, or feeling rested upon waking. These sleep disturbances can significantly impact both physical and mental health, contributing to fatigue, mood changes, and a reduced quality of life. While sleep problems are often seen as a natural part of aging, there are several reasons why seniors struggle with sleep disorders, and understanding these reasons can help in managing them effectively. 1. Changes in the sleep cycle with age. One of the primary reasons seniors struggle with sleep is the natural aging process itself. As people age, their sleep architecture undergoes changes. In particular, the amount of deep sleep, also known as slow-wave sleep, decreases with age. Deep sleep is the most restorative stage of the sleep cycle, and a reduction in it can lead to feeling unrest, even after a full night's sleep. Older adults also tend to experience more fragmented sleep, with frequent awakenings throughout the night. This can be due to several factors, including a decline in melatonin production, a hormone that helps regulate sleep, changes in circadian rhythms, the body's internal clock, and an increase in nighttime awakenings. These changes can result in shorter and less restful sleep periods, making it harder for seniors to get the quality rest they need. 2. Medical conditions and medications. Medical conditions become more prevalent as people age, and many of these conditions can contribute to sleep disturbances. Chronic illnesses like arthritis, heart disease, diabetes, respiratory problems, and digestive issues often lead to discomfort or pain, making it difficult for seniors to fall asleep or stay asleep. For instance, individuals with arthritis may experience joint pain that worsens at night, keeping them awake. In addition, medications used to treat these conditions can interfere with sleep. Some drugs, such as those used for high blood pressure, depression, or anxiety, may have side effects like insomnia or drowsiness. Additionally, seniors are more likely to be prescribed multiple medications, known as polypharmacy, which can lead to negative interactions that further disrupt sleep patterns. It's important for older adults to speak with their healthcare provider about potential side effects of their medications and discuss alternatives if sleep disruptions occur. 3. Sleep apnea and breathing disorders. Sleep apnea, a condition where breathing repeatedly stops and starts during sleep, becomes more common in older adults. This is often due to changes in the muscles of the airway, obesity, or other physical factors that affect airflow while sleeping. People with sleep apnea may not even be aware they are waking up multiple times throughout the night because of interrupted breathing, but the lack of oxygen can lead to daytime fatigue, headaches, and irritability. Other breathing disorders, such as chronic obstructive pulmonary disease, COPD, can also disrupt sleep by making it harder to breathe during the night. These conditions are common in seniors and can lead to poor quality sleep if not properly managed. 4. Mental health issues. Mental health plays a significant role in sleep patterns, and seniors often face mental health challenges that affect their ability to sleep. Depression and anxiety, which are more common among older adults, can lead to sleep disturbances. People with depression may find it difficult to fall asleep due to racing thoughts or feelings of sadness, while anxiety can cause restlessness and frequent awakenings. Additionally, cognitive decline and conditions like dementia can lead to confusion, agitation, and disrupted sleep-wake cycles. Seniors with Alzheimer's disease or other types of dementia may experience sundowning, a phenomenon where symptoms worsen in the late afternoon and evening, causing agitation and sleep problems. These mental health challenges can make it even more difficult for seniors to maintain healthy sleep patterns. 5. Lifestyle factors and habits. Lifestyle factors, including poor sleep hygiene and a lack of physical activity, can also contribute to sleep problems in seniors. Older adults may struggle with maintaining a consistent sleep schedule, which can confuse the body's internal clock and lead to insomnia or difficulty falling asleep at night. A sedentary lifestyle is another significant factor. Regular physical activity promotes better sleep, but many older adults find it difficult to engage in exercise due to mobility issues, pain, or a lack of motivation. Without physical activity during the day, it's harder for seniors to feel tired and fall asleep at night. Caffeine and alcohol consumption can also disrupt sleep patterns. Caffeine is a stimulant that can interfere with the ability to fall asleep, and while alcohol may help seniors relax, it often disrupts the sleep cycle, leading to fragmented sleep. How can seniors manage sleep disorders? Although sleep disorders in seniors are common, there are several strategies that can help manage and improve sleep quality. 1. Establish a consistent sleep routine. One of the most effective ways to improve sleep is to create and maintain a consistent sleep schedule. Going to bed and waking up at the same time every day helps regulate the body's internal clock, making it easier to fall asleep and wake up naturally. Seniors should also try to limit naps during the day, as excessive daytime sleep can interfere with nighttime rest. 2. Create a sleep-friendly environment. Creating a calm, comfortable sleep environment is essential. Seniors should ensure their bedroom is dark, quiet, and cool to promote restful sleep. Using blackout curtains, earplugs, or white noise machines can help block out distractions. Additionally, investing in a comfortable mattress and pillow can help alleviate discomfort and improve sleep quality. 3. Address pain and discomfort. For seniors experiencing pain due to medical conditions like arthritis, managing discomfort is key to improving sleep. This can include using pain relief methods, such as hot or cold therapy, physical therapy, or medication prescribed by a doctor. Seniors should also consider sleep aids such as specialized pillows or mattress toppers to alleviate pressure points. 4. Limit stimulants and alcohol. Cutting back on caffeine, especially in the afternoon or evening, can help improve sleep. Similarly, while alcohol may initially make a person feel drowsy, it disrupts the sleep cycle, so it's best to avoid drinking close to bedtime. 5. Stay physically active. Engaging in regular physical activity during the day can help seniors feel tired at night, making it easier to fall asleep. Even moderate exercise, like walking or stretching, can improve sleep quality. However, seniors should avoid vigorous exercise right before bed, as it can be too stimulating. 6. Seek professional help. If sleep problems persist, seniors should consult with a healthcare provider to rule out underlying medical conditions or medications that may be causing disruptions. In some cases, a sleep study may be recommended to diagnose conditions like sleep apnea. Cognitive behavioral therapy for insomnia, CBTI, is another effective treatment option that can help seniors address underlying issues that contribute to sleep problems, such as anxiety or negative sleep thoughts. What are the social isolation issues that people face in their 70s, and why aren't they addressed more? Social isolation is a significant issue that many people in their 70s face, and it often leads to a range of physical, emotional, and psychological problems. As individuals age, they may experience life changes that can make it harder for them to stay socially connected, leading to feelings of loneliness and isolation. Unfortunately, these issues are often not addressed adequately, despite their profound impact on health and well-being. Understanding why this happens and how social isolation manifests in seniors can help highlight the need for more attention and support for this demographic. 1. Loss of loved ones. One of the most significant factors contributing to social isolation in individuals over the age of 70 is the loss of friends, family members, or a spouse. As people age, it is unfortunately common for them to lose close relatives or friends due to death or illness. For many, the death of a spouse can be especially devastating, as it often results in a drastic decrease in daily social interactions and companionship. The emotional toll of losing someone close can also make it harder for seniors to seek out new relationships or re-engage with their community. Additionally, as people grow older, their social circles tend to shrink. Many of their peers may also be dealing with their own health issues, limiting their ability to engage in social activities or visit. This leaves older adults with fewer opportunities to connect with others, which increases the risk of social isolation. 2. Physical and mobility limitations. Physical decline is another major factor in social isolation. Seniors in their 70s may experience mobility issues or chronic health conditions that make it difficult for them to leave their homes, attend social gatherings, or participate in activities that they once enjoyed. Conditions such as arthritis, osteoporosis, or heart disease can reduce independence and prevent seniors from being as active as they would like to be, leading to feelings of dependence and isolation. The inability to drive is a particularly significant barrier for seniors. As they age, many individuals lose the ability to drive due to vision impairment, cognitive decline, or physical limitations. Without reliable transportation, seniors may struggle to visit friends or family members, attend social events, or go to public places, further isolating them from the outside world. 3. Retirement and reduced social interaction. Retirement, while offering many benefits, can also contribute to social isolation. Many people in their 70s no longer have daily work interactions, which can be a key source of social engagement throughout life. Workplaces provide an opportunity for adults to meet and converse with others regularly, and without this, some seniors find it difficult to fill the social void. The loss of a professional identity or purpose that comes with retirement can also make it harder for seniors to feel motivated to engage socially. For some, the transition from an active work life to a more sedentary lifestyle can exacerbate feelings of loneliness and isolation. They may have fewer opportunities to make new friends or maintain existing relationships, leading to a sense of disconnection from their previous social circles. 4. Technology gaps and barriers to communication. In today's digital age, technology plays a significant role in staying connected with others. However, many seniors face barriers to using technology, which can further contribute to their isolation. Older adults may not be as comfortable using smartphones, social media, or video calling platforms, which have become increasingly important for communication. As a result, they may miss out on opportunities to connect with family and friends who live far away or have busy lives. Additionally, the rapid pace of technological advancement can leave some seniors feeling disconnected or overwhelmed by the options available. They may feel frustrated or embarrassed about their lack of technological skills, which can prevent them from seeking help or engaging with others online. This digital divide can make it more challenging for them to maintain social relationships and access services or activities that would help reduce feelings of isolation. 5. Social stigma and lack of community support. Social isolation among seniors is often compounded by social stigma. In some cultures, aging is viewed negatively, and older individuals may feel overlooked or marginalized. Seniors who are isolated may feel a sense of shame or embarrassment about their situation, which can prevent them from reaching out for help. This stigma can also affect how others view and interact with them, further deepening their sense of loneliness and exclusion. Additionally, despite the growing awareness of social isolation as a public health issue, there is still a lack of widespread community support and resources specifically targeted at seniors facing loneliness. While some programs and initiatives exist, they are often underfunded or not widely available, particularly in rural or underserved areas. Many seniors do not have access to the services or programs that could help alleviate social isolation, such as transportation, social clubs, or support groups. 6. Cognitive decline and mental health issues. Cognitive decline, including conditions like dementia and Alzheimer's disease, can significantly contribute to social isolation. As people age, they may experience memory loss, confusion, and difficulty communicating, which can make it harder for them to maintain relationships or engage in social activities. Cognitive decline can also lead to anxiety, depression, and a lack of confidence, further isolating seniors from their social networks. Mental health issues in seniors are often underdiagnosed or overlooked, and the stigma around mental illness can prevent seniors from seeking help. Depression and anxiety, which are common among older adults, can also make them less motivated to engage in social activities or leave their homes, leading to a vicious cycle of isolation. 7. Why aren't these issues addressed more? Despite the significant impact of social isolation on seniors, the issue is often overlooked in both healthcare and social policies. There are several reasons why this happens. First, there is a lack of awareness about the severity of social isolation and its effects on health. While physical health problems in older adults are often well documented and addressed, social isolation is not always seen as a critical issue, even though it can have similar consequences on health, such as increased risk of depression, heart disease, and even early death. Additionally, there is often a lack of funding and resources dedicated to addressing social isolation in seniors. Many community programs that could provide support, such as senior centers, transportation services, and social activities, are underfunded or unavailable in certain areas. Furthermore, family members and friends of isolated seniors may not recognize the signs of loneliness or may not have the time or resources to offer support, leaving the individual without the help they need. Lastly, social isolation is sometimes considered a normal part of aging. This perception can make it difficult for both seniors and those around them to acknowledge that isolation is a serious problem that requires intervention. As a result, social isolation among seniors is often not given the attention or urgency it deserves. Why is chronic pain more common after 70, and what solutions do doctors often overlook? Chronic pain is a widespread issue among individuals over the age of 70, affecting their quality of life and overall well-being. It is not uncommon for seniors to experience persistent pain due to various factors, including age-related changes in the body, health conditions, and lifestyle. Despite the growing recognition of chronic pain as a critical concern, it is often inadequately addressed in older adults. There are several reasons why chronic pain becomes more prevalent as people age, and unfortunately, some solutions are frequently overlooked by doctors and healthcare providers. 1. Age-related changes in the body. As individuals age, the body naturally undergoes a series of changes that contribute to an increased likelihood of experiencing chronic pain. One of the primary factors is the gradual wear and tear on joints, muscles, and bones. Conditions such as osteoarthritis, which is the breakdown of cartilage in the joints, become more common with age. As cartilage wears down, the bones in the joints can rub against each other, causing pain, swelling, and stiffness. Additionally, the spine undergoes degenerative changes, leading to conditions such as spinal stenosis, where the spaces between the vertebrae narrow, causing pressure on the nerves. This can result in pain, numbness, and weakness, particularly in the lower back and legs. As people grow older, the body's ability to repair damaged tissues diminishes, which means that injuries or inflammation may take longer to heal, contributing to chronic pain. Another common issue in older adults is the decline in muscle mass and bone density, both of which play a role in the body's ability to support itself and manage stress. Weak muscles and brittle bones increase the risk of fractures, sprains, and strains, which can lead to long-term pain that may not subside easily. 2. Chronic conditions and diseases. Chronic pain in seniors is often linked to various underlying health conditions. Conditions like diabetes, fibromyalgia, rheumatoid arthritis, and neuropathy can cause persistent pain. For example, diabetic neuropathy, a common complication of diabetes, results in nerve damage that causes pain, tingling, and numbness, particularly in the feet and hands. Similarly, fibromyalgia is a condition that causes widespread muscle pain, fatigue, and sleep disturbances, which are particularly prevalent among older adults. Cancer, another common health issue in older individuals, often leads to chronic pain as the disease progresses or as a result of treatments like chemotherapy or radiation. The cancer itself may cause pain by affecting surrounding tissues and organs, and the treatments may lead to side effects that persist long after the therapy has ended. Cardiovascular diseases, such as peripheral artery disease, can also lead to chronic pain, especially in the legs. This condition occurs when blood flow to the extremities is reduced, causing pain, cramping, and weakness, particularly during physical activity. These underlying conditions can cause pain that may not always be immediately linked to the original source, making it harder to pinpoint the exact cause. 3. Limited physical activity and sedentary lifestyle. Inactivity is another significant contributor to chronic pain in older adults. As people age, they may reduce their physical activity levels due to fear of injury, fatigue, or a lack of motivation. A sedentary lifestyle can exacerbate pain, particularly in the muscles and joints. Lack of movement can lead to muscle stiffness, joint discomfort, and reduced flexibility, making everyday tasks more challenging and painful. Exercise is essential for maintaining muscle strength, joint flexibility, and bone health. However, seniors who avoid physical activity because of pain or fear of causing further injury may find themselves caught in a vicious cycle. The more they avoid movement, the more their muscles weaken, leading to greater pain and discomfort. Without regular physical activity, the body's ability to cope with pain decreases, and the pain can become chronic. 4. Inadequate pain management and underdiagnosis. While chronic pain is a prevalent issue among seniors, doctors may not always address it effectively. One reason for this is the tendency to normalize pain as a natural part of aging. Many healthcare providers may assume that pain is an unavoidable consequence of getting older, leading them to downplay or overlook the importance of treating it. This can result in patients suffering in silence without receiving appropriate care or interventions. Moreover, chronic pain in seniors is often underdiagnosed or misdiagnosed. Some conditions that cause pain, such as arthritis or nerve damage, may not be fully explored by doctors. Seniors may also fail to report pain to their doctors either because they believe it is an inevitable part of aging or because they do not want to burden their healthcare providers. As a result, pain may go unaddressed or treated with inadequate solutions. Another common issue is the over-reliance on prescription medications, particularly opioids, to manage chronic pain. While opioids can be effective for short-term relief, they come with significant risks, especially for older adults. Seniors are more susceptible to the side effects of opioids, such as confusion, constipation, and sedation, and the long-term use of these drugs can lead to dependency and other complications. Unfortunately, doctors may not always consider alternative treatment options before prescribing these medications. 5. Overlooking non-pharmaceutical solutions. While pain medications are commonly prescribed to manage chronic pain, they are not always the best or only solution. There are several non-pharmaceutical treatments that doctors often overlook, even though they can be highly effective in reducing pain and improving quality of life. Physical therapy is one of the most beneficial treatments for chronic pain. A trained physical therapist can help seniors improve their strength, flexibility, and posture, which can alleviate pain caused by joint or muscle issues. Through targeted exercises, patients can improve mobility and reduce stiffness, leading to long-term relief. Unfortunately, many doctors fail to refer patients for physical therapy or underestimate its effectiveness. Other alternative treatments, such as acupuncture, massage therapy, and chiropractic care, can also provide relief for chronic pain. Studies have shown that acupuncture can help manage conditions like arthritis and lower back pain by stimulating the body's natural pain-relieving mechanisms. Massage therapy can reduce muscle tension, improve circulation, and decrease stress, while chiropractic adjustments may help realign the spine and alleviate nerve compression. Cognitive behavioral therapy, CBT, is another effective, non-drug treatment for chronic pain. CBT helps patients change their perceptions and emotional responses to pain, teaching them coping strategies and relaxation techniques. This psychological approach can reduce the emotional burden of chronic pain and improve overall well-being. 6. The importance of comprehensive pain management. In conclusion, chronic pain is a common and often debilitating issue for individuals over the age of 70, and it is frequently compounded by the natural aging process, underlying health conditions, and limited physical activity. However, despite the significant impact chronic pain can have on seniors' lives, it is often underaddressed by healthcare providers. To improve pain management, doctors must take a more comprehensive approach that includes not only medication but also alternative therapies, physical therapy, and mental health support. By recognizing chronic pain as a multifaceted issue that requires personalized, holistic care, doctors can help improve the quality of life for seniors dealing with persistent pain. Seniors themselves must also be proactive in discussing their pain with their healthcare providers and exploring a wide range of treatment options to find what works best for them. If you liked today's discussion, don't forget to like the video, and if you haven't subscribed to the channel yet, hit the subscribe button and the bell icon to stay updated with every video we release. And yes, don't forget to share your experiences and thoughts in the comments. Every comment is special to us. Your feedback helps us improve further. We'll continue to meet you in every new video on this channel, so until next time, take care.